Hi, Cody Metropolis here with Integrative Dry Needling. Today I wanted to bring you a case of management of the radial nerve palsy with neurological dry needling. I had a patient that came to me approximately 3.5 months post-injury. He unfortunately had drank too much. He passed out, woke up the next morning, and had little to no feeling or movement of the left wrist, the left hand, and inability to move his thumb. Patient saw a hand specialist immediately and was put into a wrist brace and told to follow up in 3 months to see where his progress had come. They did not recommend therapy at that time. Patient had a second opinion about 2.5 months post-injury, and an EMG was completed at that time. The EMG revealed that he had severe left radial nerve damage distal to the triceps with decreased recruitment, decreased activation, and denervation of the radial nerve. Patient was told to follow up within about a month to see if there was any progress, but most likely to plan for a tendon transfer surgery at that time. No therapy was recommended. Patient sought me out privately, and when he came to me, he really had the following signs and symptoms. This was his first appointment. He had very limited wrist extension, weakness throughout the entire left upper extremity, minimal to no full digital extension. He had no movement of the thumb, palmar abduction, radial abduction, circumduction. His activities of daily living were significantly impacted, and he really didn't have functional use of the left hand at that time. When we did his treatment, he had a pretty significant adverse feeling of needles from previous experiences, whether it was shots, vaccines, whatever. He did not like needles. So he was willing to try the treatment, but the first treatment we left in situ. We did not do any manipulation, and we left the needles in for about 10 minutes. We did C5 and C6 bilaterally. We did the axillary nerve emergent point, the infraspinatus. We did the emergent point of the radial nerve between the two heads of the triceps. We did any symptomatic points throughout the lateral humerus. We did the deep radial nerve homeostatic point, the posterior interosseous nerve, the supinator, and the superficial radial nerve homeostatic point. Throughout the entire treatment, patient had significant, heavy achiness throughout the left upper extremity. He had no sensation to light touch at the superficial radial homeostatic point, but he did feel pinprick and he had trace sensation during the dry needling treatment. These two are comparing the first session and the second session, which was 6 days in between. You can see on the right, he has significant changes in his wrist extension, finger extension, as well as just overall control of the hand. He started feeling more sensation throughout the hand and was able to start using the hand a little bit. He said that he was able to type for about 3 minutes without it being completely fatigued. He said that the heaviness sensation was less, but that obviously he was still having functional deficits throughout the left upper extremity and activities of daily living. We did 6 sessions total. This was his 6th session. So from October 24th through December 5th. We did the same needling treatment that we talked about earlier in this video, but we added stim for 2 minutes, and he had significant changes overall. You can see he has greater control of the wrist with digital extension. He has full thumb adduction, both palmar and radial abduction. He has circumduction, full supination. He is now back to work full time. He owns a concrete company and is able to do heavy tool work. He's typing. He went skiing this past weekend and was able to go surfing while he was on vacation. And really back to the gym, minimal complaints of fatigue and heaviness after a long day of work. So overall with this patient, we were really able to resolve the neuromuscular guarding that he had, as well as the neuroinflammation of the radial nerve, not only proximally and distally, but both laterally and medially as well. He had significant increase in active range of motion, his functional movement patterns, his occupational performance, and overall independence with activities of daily living. He had increased left thumb and hand strength, both tested with dynamometer and pinch strength, as well as over upper extremity strength per manual muscle test. We were having immediate and long-lasting changes throughout the left upper extremity due to dry needling by treating the neuro trigger points and the radial nerve pathway, restoring neuromuscular balance by normalizing his tone and removing those nociceptive signals. So hopefully this was helpful, and we'll bring another one to you soon. Thanks.